Hello. If you or someone you care about is preparing for dialysis, you're probably weighing your options. The goal of this quick explainer is to walk you through the essential facts about AV fistula surgery so you can feel clear and confident when you talk with your medical team.
So, you're considering an AV fistula. It's a big decision. Let's review the information you'll need together so you can feel really good about the choice you make for your health. Okay, so let's dive right in. When we talk about a fistula, there are a couple of common starting points. Which one is right for you? Well, that really comes down to your own unique anatomy, which is something your surgeon will carefully assess. Your two main options to start are typically the radiocephalic and the snuff box fistula. The radiocephalic is created just above the wrist. It's the most common first choice for a reason. Then you have the snuff box fistula on the back of the wrist. It has a very high patency rate, which just means it's got a great track record of staying open and working well. And what's really smart about it is that it preserves other blood vessels, which keeps your options open for the future if you ever need them. Now, what about the surgery itself? What does that actually look like? Most people are relieved to hear that it's a pretty straightforward procedure. It's usually done with just local anesthesia, and you're in and out in just a couple of hours. Let's break down the process. First, your surgeon simply finds the best suited artery and vein. Then they create a small, direct connection between them. And over the next few weeks, that new connection matures and gets stronger. Think of it as turning a small country road into a super highway for blood flow. That's what gives you that strong, reliable access you need for dialysis. And that brings us to the most important part of this whole conversation, weighing your decision. We have to look at the powerful, long-term benefits and balance them against the immediate, but manageable, risks of the surgery. When we look at the benefits, we're really talking about the long game. A fistula can last for many, many years with the right care. It has a much lower risk of infections and blood clots when you compare it to a catheter. It also allows for higher blood flow, which means you get a better, more effective dialysis treatment. And all of that adds up to a better quality of life. Now, on the other side of the coin, we have to talk about the immediate risks of the procedure itself. Things like an infection at the incision site, some bleeding, or the possibility that the fistula just doesn't mature properly. It's important to know that your surgical team is completely prepared for all these possibilities and knows exactly how to manage them. So think of this information as your starting point. The whole idea is to help you prepare for a really thorough conversation with your doctor. Asking them your questions is truly the best way to make sure you're choosing the path that is absolutely right for you.